IVF. Oh my god, that word sounds scary, does it? Contrary to popular belief, an IVF is neither a complicated nor a painful and definitely not a scary procedure. It is a simple and straightforward procedure. And there are a few things that you should keep in mind if you have been advised IVF or if you are undergoing IVF. First of all, what are the chances that you can expect from it? There is not a 100% guarantee that you may conceive in the first shot itself. But yes, out of all the treatment options available, that is trying naturally, doing an IUI or doing an IVF definitely has the highest chances out of all the options available. What exactly your chances are in your case would depend on a number of factors such as your age, your ovarian reserve, your husband's semen parameters. So these are things that you should discuss with your doctor before starting the procedure so you have a realistic expectation. The second thing to keep in mind is not to be afraid. It is not a painful process. Yes, from the first or the second day of your cycle, there will be 10 days of injections, an injection a day that you'll be taking. So there's a prick that you have to tolerate every day. But these are not thick needles, they are not heavy injections. It's just a normal prick. So after these 10 or 11 days of injections are over, your egg pickup will be scheduled. During the 10 or 11 days of injections, you will be called for follicular monitoring 3 or 4 times to check the growth of your follicles on ultrasound. The egg pickup is a procedure which is done under short general anesthesia. It barely takes 5 or 10 minutes. It's a very simple process. It's not a surgery. There are no cuts. There are no stitches that are involved. It's done through the vagina, and because you are fast asleep, you are not going to feel a thing. You will wake up as soon as it is over, and you'll rest for a couple of hours at the clinic, and then you will go home. 5 days later, the embryo transfer is done. The embryo transfer and embryo freezing should ideally be done at blastocyst stage, which is 5 days after the egg pickup. This is an absolutely painless procedure. You don't need anesthesia for it again. It just takes a few minutes. After that, you will be on some luteal support medication, which will go on for about 10 days till your beta-HCG. The luteal support medication can be taken at home. You don't need to be on bed rest after the embryo transfer. Bed rest can in fact reduce your chances of conceiving. So another thing to keep in mind is stay active. The routine activities and routine diet that you have been used to, you need to continue. Yes, if you have unhealthy habits in your diet, those you need to quit. For example, not too much caffeine, no smoking and no alcohol. Apart from that, there are no dietary restrictions as well. There are no activity restrictions as well. We don't advise heavy impact exercises, but light moderate exercise is absolutely fine. Once the beta-HCG test is done, you will know if it is positive or not. Just this period of waiting between your embryo transfer and the beta-HCG can be quite excruciating. So it's best to keep yourself busy doing all the things that you love to do, including continuing your job if you are working, and if not, focusing on doing everything that makes you happy. Be it taking up a hobby such as cooking or gardening or taking care of your pets, or whatever you can do to keep yourself busy, keep yourself occupied. When you keep yourself happy and you are in a positive state of mind, your chances of pregnancy are the best.